Good afternoon, friends, neighbours, comrades, all. Salam alaikum. I've had my surgery now, yesterday. I am precisely 1 day post-op. Check this out. Kinda gross. But there you go. They did a pretty neat job of it. But I wanted to make a quick video to talk about why am I having MPFL, why have I had MPFL reconstruction, and why have I had it on both knees. Now, it seems like there are some people out there who may have the same condition I do and not know it. I've certainly come across people in, forums and YouTube comment sections and stuff which certainly exhibit the same symptoms, behaviours that I do, but they don't seem to know why. And they may have what I have. What I have is something called trochlear dysplasia, which essentially means that in a normal knee, the kneecap sits in a groove which keeps it tracking correctly, stops it from it's one of the things that stop it from dislocating. And due to probably genetics, or possibly some studies believe it may even be due to impact trauma in early life, when you're a little kid, while that part of your body's still developing, while the knee is still developing. I do not have a groove, so that groove is called the trochlear, and I do not have that. Some people have it, and it's very shallow, which means they can be prone to dislocation. Some people don't have it at all, and they actually have like a concave, is concave the right word? Convex, a dome basically, where there should be a groove, and that makes the kneecap very, very unstable, and that's what I've got. I've had MRI scans on both knees which confirm this, and the body's very clever. My body has the muscles around the knee have overdeveloped to try to protect and try and stabilize and try and keep it in, but it's not really enough, unfortunately. So a surgical procedure is needed. So that's what I've got. It may be that you've got it too. If you are having knee dislocations and you're not really sure why, if it's happening over and over again, go get yourself an MRI scan. MRI scans are the ones. MRI scan will not only tell you about the damage, because in all likelihood, if you've had a dislocation, you'll have damage to a ligament. You'll probably have some damage to cartilage, and you want to know about that because that has implications for later in your life. I'm probably going to get osteoarthritis in at least one of my knees because of that. But they'll be able to tell you for sure what your issue is, and it may be that you may have something else, but it may be like me, you've got an issue with your trochlear. Now there is a procedure you can have where they can actually go in and cut you a trochlear. They can cut a groove into your femur, I think. I haven't had that, and if I can avoid that, I will, because that's very invasive. From what I understand, it's pretty uncommon, so there's not a huge amount of data information available, at least not that I could find. But what I could find was that there's a relatively high reporting of pain going forward after that, which is something generally I don't have, and I particularly don't want to have that for as long as I can. So rather than do that, I imagine what will probably end up happening is I'll carry on like this. Be careful with the knees. Don't do anything high impact. I've had these operations now, so they should be reasonably stable as long as I do the work and keep them strong. And I imagine once the pain gets really bad later in life, I'll probably end up having at least one knee replacement. Maybe not. We'll see. But yeah, just that was what I wanted to say.